Yo, how are you doing, folks? Welcome to episode 47 of the Simpa Life Podcast. I am once again, unfortunately, not joined by Mr. Maka this evening. He is obviously taking a bit of time out, as we've said, so wish him all the best and send him some love in the comments below. I'm sure he will be back in the not too distant future once life kind of smooths itself out again. But I'm here as always, and I'm joined today by a very interesting guest, a man who's been on my list for quite a while. He is a mental health nurse rather than an integrative psychotherapist, although both are true. Just a different wording. I'm actually quite proud of how I got that out there. That was good enunciation. He's a clinical partner at Foundations Healthcare up in the northeast of England, who are a specialist GP practice who provide clinical services to people who are socially excluded, such as the homeless, people who consume alcohol and drugs, and asylees, which are a collective term for asylum seekers, for anyone that doesn't know the terminology. He is Mr. Danny Ahmed. Thank you for joining me, brother. How are you?
I'm really well. Thanks for having me on. I really appreciate the chance to chat with you.
Likewise. I mean, I've spent quite a bit of time with this project and over the past couple of years with my activism, trying to draw parallels and commonality between the various struggles. And I think one of the things that really inspired me when I saw Foundations is you guys have tried to integrate it. You've not just kind of gone, oh, we can solve one problem. You're trying to go, okay, people who use drugs often face homelessness or vice versa as a way of sort of pacifying or escaping pain or trauma and tragedy. And so I first want to, I suppose, doff my proverbial cap and say, well done for sticking your necks out. And you guys you've been at this a while, haven't you?
Yeah, that's right. We've been around since 2001. So we were really sort of brought into existence, if you like, as an organisation when Middlesbrough was facing a epidemic, really, of heroin use. And at that time, people who were trying to access treatment for heroin addiction were waiting up to 6 months for a treatment appointment. Their healthcare needs were not being met. The GP population struggled to meet their needs. So often you had a group of people who couldn't get access to treatment but for their substance use, but also couldn't get access to treatment for any healthcare issues. So we were kind of brought in to look at that and explore, look, is there something we can do to support people with both of those needs, really? And that's exactly what our kind of primary model is, that we provide the same services that you would get at your GP practice, but for particular groups of who've got particular vulnerabilities. We were commissioned for 6 months and for a small number of patients. And here we are, what's 2021? So is that 20 years? Yes, 20 years. In 20 years we've been here doing what we think we're good at, and trying to support people who quite simply are often disenfranchised in society. And in healthcare, they find the systems of healthcare very, very difficult to navigate. And our whole ethos is that we remove those barriers, we remove those complexities, and to make accessing our service as easy as possible.
It's really interesting. Recently, I spoke at Product Earth, and afterwards, a GP, a newly qualified GP, came to me and he'd asked a question during the presentation of what can doctors do? And I said that you need to become more caregivers rather than being sort of perpetuators of stigma. And I explained to him that the reason he's not got patients telling him they're using cannabis is because they can have their children referred to child services. You can have your license removed by being referred to the DVLA. They have a lot of power, but often too little understanding. And I think that it seems that your service, that obviously was only given a short window of time, has clearly smashed it and been able to provide that full spectrum of service for those most in need in the area.
Yeah, I think that we've been able to tap into what people need and to be able to have conversations and allow people to feel trust with, working with us. And yes, we might have to have difficult conversations. Yes, we will have to consider safeguarding in some cases at some times, but all of that can be done with compassion. All of that can be done in a way that is humanistic. And I think if you can do that with any individual, however tough that conversation is, I think that stands you well, over time. People people are people, and they accept and understand when they feel connected. And I think that's what we strive to do. I think a lot of the feedback we get is that we most of the time we get that right. Obviously not all of the time, but most of the time we get that right.
Yeah, it's interesting there that you said with that humanistic approach, and that remembering that people are not just statistics. They are not just another homeless person. They are not just another sex worker. They are not just another person who's struggling with a dependency issue on drugs. They are a person in a position that needs help, that needs compassion, that needs some form of outreach. And I think that exactly what you said, it almost re-enfranchises them through your approach, because it allows that trust and that bond to be repaired, instead of everybody that is in a position of authority being the enemy or the oppressor, and they're going to be a voice of going, no, you shouldn't do this, stop this, and then we'll help you. I think having that compassion-based approach, it really goes far in society.
I think you're absolutely right, and I think it fits really well with our kind of ethos. And our ethos is around harm reduction. So, individuals who need to connect with our service have had some difficult times. If you need to get involved with my service, you've come to a difficult place in your life. But we're not in a position, and I don't believe anyone should ever be in a position where they suggest somebody should or shouldn't do a behavior, even if there are problems associated with that behavior. And I think that again comes across. I don't talk with drug users and say you need to stop using drugs. What we talk about is that there are some risks associated with this. You can tell me about the things that you get from this. And what we want to do is make sure you can keep yourself as okay as possible. If you want to change that, then we can plug you into people who can support that. If you don't, keep yourself safe. And that's exactly what we're attempting to do. So we try and meet people where they're at. If somebody needs to have clean equipment, then that's what we're looking at. If somebody wants to look at entering rehab because that's where they're at in their journey, then that's the support that we'll provide. We look at one of our key interventions is heroin-assisted treatment, and that's about providing a medication similar to heroin to individuals who fail to benefit from other treatment options before. And we believe that, we should have these kind of evidence-based approaches, because if you don't, people die. And that's exactly what we're seeing in the group of people that I work with the most, which is people who've got problems with heroin. They are dying on a daily basis, and it's hard to be around. It's hard to watch the patient group that you've spent your life trying to support literally dying around you. That I've lost friends. I see a group of peers dwindling away, and I want that to stop. And for me, a lot of that comes from the way that we manage substances, the way that this group of people are stigmatized. And if we can make some changes on that front, if we can humanize people who use drugs, then we start to make a change in what needs to happen to support people better.
Yeah, definitely. It's a really tough one, isn't it? Because we live in a culture where the cognitive dissonance, the barrier between their accepted reality and the knowledge of the full width of reality, as it were, is so strong, in that we are probably one of the most problematic drinking cultures in the West, not in the world, because actually if you look at into developing nations, there are some serious problems being exploited, ironically, by Western companies. But in terms of our culture, we can go and get beyond intoxicated, have colleagues in high functioning roles within business, literally pissing on the side of the street, vomiting on cars and stuff, even getting arrested and detained, but would not then face any punitive action at work. Yet we then have on the other side of this, people like Dr. Carl Hart coming out and admitting to his own adult consumption, and as he would term it himself, actually recreational consumption of heroin. And then the beratement, the abuse and the stigma was still there, even at a man who had worked so hard for so long, held down a viable career and was held in such high esteem, or still is high esteem and respect by a lot of people, not just within drug reform, but anybody who's, I suppose, got a vested interest within this. So I think if you can see that occur at that level, we can obviously understand, and I think my listeners are hopefully slowly beginning to understand how pervasive and destructive and corrosive that stigma really is, that you can start as a person with good intentions and you end up in the worst position imaginable. There are no immoral people in my eyes. There are no evil people. There are people driven to, I wouldn't even say evil action, because it's justifiable it's quantifiable in their mindset and in their world. And I think if we have that wider compassion approach, we start to get somewhere. So it's someone else, again, I applaud your service for, is not being an abstinence-based recovery program. It's not the requisite of compassion. You can still give people harm reduction advice, and you can still offer them help and access to services that can and do save lives.
Absolutely. And, you know, we have a term that we use quite often: you can't recover if you're dead. And you know, that's got to be our starting point with individuals. I think that, you know, we've got a group of people who end up with problematic substance use. They do not deserve to die because they've got a problem with drugs. Their drug problem is a symptom of their previous difficulties. So it's no more than they've found a coping mechanism to deal with some very difficult stuff in life. Stuff that I don't know how I would deal with. You know, you hear some people's stories and you think, do you know what? I completely understand how you've got to this position. It makes sense. The path you've chosen makes sense. The problems that path causes you, it's not for me to judge. It's for me to try and support and help people keep as safe as possible, to get to a point where they might be able to deal with some of those past difficulties. Some of those traumas, those multiple traumas that they have experienced. But again, I don't sit in a position where I think that anybody who's had a trauma needs to go and get the help and support. I hope that they can, but if they're in a position where they feel they're not able to, then we have to respect that. We have to respect the fact that getting near those difficult emotions may be too much for an individual. And that's why we've got to meet people where they're at.
Yeah, it's interesting. That then bridges into kind of this renaissance that we're having, I guess. And part of it is unfortunately driven by vulture capitalism, but the renaissance being in psychedelics or entheogenic compounds, however you want to use whichever terminology. But ultimately, substances that are currently classified and criminalized and classified as being, in some cases, toxins, that are now being researched as ways to, here's a very loose way of describing it, create padding within one's own consciousness to be able to safely explore the sharpness of trauma and of past experiences. That the power of the brain, obviously, is an unbelievable thing to be able to build these walls and these fortresses in the mind for decades to hide these things. And a lot of us don't know we're traumatized. There is an argument that was made many years ago in psychotherapy that there is the original trauma of birth, and that from this compounds everything, and we all end up as just really damaged little monkeys trying to figure ourselves out, like looking through a mirror with smear on it. You know, you can't ever get the glimpse of it. And I think that part of that is in some way true, but it's exactly what you said before. No one should be forced to seek recovery from their trauma, but everybody should be given an option to cure it with curiosity and compassion and kindness, explore it. Because once people, when you realize it, is even as a child, I think the reason like kids break things or they interact with their environment in their ways is to see consequences, to see results. I think the same thing is then true of people on the larger scale as they grow older, that if you can actually give them this mechanism of seeing results rather than just demonizing and pushing them to the sides, that they'll grow and they'll want to grow and they'll actually seek, not necessarily, I'm not going to say for recovery, because I don't believe that sobriety is the answer to everybody. I actually would love to live in a world where one part of it, we mitigate trauma, so we're reducing the escapism mechanism, but that we can still allow substances to proliferate for conscious, intelligent, and deliberate exploration of our consciousness and our psyche.
I think you're absolutely right. And I think what's really interesting with the way that we manage substances as a society is just a mess. There's no other better way of thinking about it, really. We've got, you know, if we take the UK, we've got the Western world, the two most sort of dangerous substances are perfectly legal. You smoke tobacco will kill you. But we regulate that. We've learned that, there are ways that you can regulate the way, the age that people access it. The same with alcohol. We know that there are dangers associated with alcohol, and we put provision in place to manage that. But yet we've got far less dangerous substances where we just take a complete blanket approach that you can't, we are not allowing access to this substance. And that's not based on anything other than a moralistic viewpoint of this substance is okay to take and this substance is not. And really what we need to get to, in my opinion, is to an evidence-based regulated market. So we're actually looking at, your access, that people's access to a substance is based on its potential risks. So, cannabis, we know, is a fairly low-risk substance, and there's a lot of models across the world now of cannabis shops and cannabis cafes that works really, really well. That's a really sensible way to manage this. You can go to an environment, talk about the substance, talk about the risks, talk about the positives, and access a really safe supply of this substance. MDMA is, again, a relatively low-risk substance when used in the right conditions with the right information. We could allow access to a substance like that through a similar model or through a chemist-type model. So again, that we allow access to the substance with the right information. All of that makes a massive difference on the user of that substance. They no longer have to play lottery with their lives. They no longer have to get mixed up in the criminal world and run all the risks that are associated with that unnecessarily, so that they can actually change their headspace and go to dance on a Friday night. Nobody should go out to dance on a Friday night and not come home. And I think that's part of the problem that we've got now. And I always think about, the way that we treat substance use and the kind of harm reduction approach has just been crazy, really. We do it in every other aspect of our lives. So, if our kids want to go and ride on a bike, we don't say there's too many dangers with that, you can't ride a bike. What we do is we get them a bike with stabilizers, we get them a helmet, and we get them the pads they need. And they can ride that bike as safely as possible. We reduce that harm. Mm-hmm. If we've got somebody who wants to play football, we give them shin pads and the right equipment so they can do that without breaking their legs in general. Yeah. If somebody wants to do one of the most crazy things that I can ever think of, which is to go up in an aeroplane and jump out of it, we have some training. We give them a parachute. We give them someone to jump with. We reduce those harms. But when it comes to drug use and to substance use and substance users, what we're effectively doing is saying to them, you have to jump out of that aeroplane and you don't have a parachute. You are risking your life because of the way we allow or restrict the access to this substance. And that has got to change. We are losing too many people, too many damages and too much, impact really from the way that we manage substances. And it could all be so different. Yeah, it really could. And you bring up a very valid point. It's something that I often go back to, of saying that, if I have the right to put on a squirrel suit and jump out of a plane and hurtle at a couple 100 miles an hour through a tiny block in a rock, not only am I allowed to do that, but I could approach Red Bull, get them to sponsor it. I could get insurance and coverage. I can make money off it. I'm happy to do that. That's all cool. And go to the edge of space and jump out like Felix Baumgartner did. Baumgartner. I'm butchering his name. I do apologize to you. I think he's Belgian. So my Belgian listeners, I do know you're out there. Holla, guys. So it's weird that we're allowed to do these extreme things and we're celebrated for it. And they're like, wow, look at this. And it's almost given, especially to the men doing it, is it's some form of masculinity. It's some form of bravado, some form of rah. And they're deemed as an alpha male, as it were, to use a very antiquated term. But on the other side of then, you look at the psychonauts of actually people who then don't really follow the drug laws and they live in their own culture and society. And there are a hell of a lot of us out there. They see it almost on the other side, that those that are brave enough to explore those psychedelic realms that are then going out and seeing what happens if you mix this and this, and they are doing those field research. I think of Alexander Shulgin, who basically gave us most of the modern ABC drugs, as it were. And without that foundational work, the compounds that are created as a consequence of prohibition would be far more dangerous. So we actually have this harm reduction ethos within the community, drug users. I first saw, I'd always, for a while, there was always two types of dealers I'd deal with as a young man. And there would be the kind of guy who is, I'll meet you fast, I'll get rid of the thing, you're gone.
And then there was the guy who wanted to big up his product and was really proud of it and went, I can tell you where they got it from, and we've had it tested and whatever else. And you notice the difference in the quality in the people. But then when the Loop appeared on the scene and started testing at festivals, I was sat in one of the shisha bars in Boomtown. One of my mates bought a couple of pills, and the guy he got about 10 yards and turned around and came back and went, mate, strong as shit, take half. It's harm reduction advice from a dealer. It was I literally grin to grin. I lit up and I was like, that is the future I want to see. I want to see that kind of information education. And it's kind of since those interventions over the past 8 years, 9 years, I've seen the two sides of it change. The guy who's proud, they're going to get their stuff tested. They're trying to get it from good marketplaces. Ironically, most of it's off the dark web. But then on the other side of it are these guys that have gone the opposite way, that are diluting, they're adulterating, that are just trying to maximize, and they're mimicking products of the legitimate products. So they'll press a same looking pill to get onto the hype of these other drugs. And it's very much causing so much confusion to people.
Absolutely. And it creates that lottery, doesn't it? I think I saw a story the other day or the other week about somebody who dealt MDMA, and he realized his product was dangerous, and he destroyed the batch. He destroyed it, and it made a bit of publicity, really. And that's absolutely, where we need to get to. We need to be at a point where, people are looking out for other people, and that's an absolutely key element of where we need to be. We're all somebody's son, and or somebody's brother or somebody's father, and nobody needs to die from taking substances. There just is. It can be perfectly well managed, but we give these most potent. The law means that these most potent substances that we could manage better are just pushed to the fringes. And it's great that you're feeding back that there are people out there that are operating morally, but the space is there for people to operate immorally, and we don't have to have that space. We could just make it so different. I always go back to think about the Misuse of Drugs Act, really, and it's 1971, and any law, any acts like that is there to, in theory, to protect us, isn't it? It's there to keep us as safe as it possibly can. That would be the idea behind such a law. But you've got to look at where we're at now. So that law restricts the amount of substances that are available and was to aim to reduce the harms associated with it. Well, here we are now in 2021. We've got more drugs readily available than ever before, and more people dying than at any other point. So very clearly something is not working, and that act is no longer protecting us, and we need to change it. We need to be looking at other ways of managing substances to really move forward as a society. People often talk to me about, what can we do differently, and what interventions can we put in place to support people? And you can talk a lot about lots of interventions. I provide heroin-assisted treatment. I'd like to be able to open drug consumption rooms or overdose prevention sites that we see so successfully in other countries. And these will make some difference, but the biggest difference that could be made is how we regulate substances, and that is the area that we need to push the most.
It's interesting, yeah. I'm thinking of Archbishop Desmond Tutu quote, and he's saying, for too long we've been pulling people out of the river. We need to go upstream and find out why. Now we need to go upstream and find out why they're falling in. And so you guys are you're applying plasters as fast as you can to people. You're just doing field triage. You're just putting people together and kicking them back on the street, putting them together back on the street, putting them together back on the street, because it's such a processing line of just these people being harmed and damaged and written off into the system so young and so early. And they're put into a reality that is not expressed in the mainstream. If you only watch the mainstream channels, read the mainstream news and engage in mainstream radio or whatever, you think everything's hunky-dory and fine. But there is millions, tens of millions of people living in this other subculture and society and world that have this entire different mode of operating every day, that have these different marketplaces, these different cultures, these different reference points that are just not spoken of in the mainstream. So they're constantly pissing around with this idea of, oh, we'll get it a couple of years, we'll review it, we'll have another look into this. And every day someone is risking overdose. Every day someone is risking losing their life to suicide. Every day someone is falling into poverty. They're losing their home, their livelihood. Families are breaking up, causing more trauma in the next generation. And there is just this pandemic of destruction within the consciousness of people, because the systemic cause of this within the whether it be through design or through accident, of the policies of this government. Poverty is man-made, it's manufactured. And so we know that if you are impoverished, if you are from a marginalized group, you are far more likely to fall into a dependency relationship with substances, because it's a form of pacification and escapism from the pain, the misery of living in a society that says that this is what is good and this is all there is. And your everyday doesn't live up to that, and you don't belong there. And there's this alienation and isolation, disenfranchisement that you speak of. And exactly that, there has to be a conversation of whoa. He might be a pothead, but he's not a bad person. You know, that guy might like to go out the weekend and like take pills, like really take pills like we used to back when we were 18, 19 in Durham. But they still go down and hold the job on the Monday. Yeah, they may have a bit of the Wednesday blues, but they're smart enough to understand, well, I get some orange juice, I get my vitamins back up, you know, I'll work on serotonin levels, etc. If we have that information and education, we can negate what is the perceived ills and harms of these things.
I think you're absolutely right. And these are the conversations that are missed, aren't they? Mm-hmm. I think, you know, you made some really good points about, you know, deprivation and the kind of links with substance use. And I think Middlesbrough, the area and Hartlepool, where we have services and we support individuals. I'll take the stats for Middlesbrough, and it kind of just rams home the point you were making, really. So Middlesbrough's got half of its wards are classed as the most deprived in England, and we have the most deprived ward in England within there. So the level of deprivation is profound. And then what you see based on that deprivation is that Middlesbrough's got, per head of population, the highest number of heroin users than any other part of England and Wales. So that link between deprivation and problematic drug use are there to see. Then what you've got as a knock-on from that is that we've got the second highest level of drug-related deaths in the whole of England. So that absolute link between having a really difficult start in a difficult-to-live environment pushes you towards problematic substance use, which pushes you towards an early death. And we see that kind of information in some of the sort of health statistics that we're able to look at working with heroin users. So if you use heroin in the sort of northeast of England, then you're over twice as likely to have asthma. You're over twice as likely to have COPD. And COPD is a lung condition that affects individuals sort of from the age of 67 onwards. But in this group of individuals, they're getting diagnosed at 39. So this is a debilitating sort of respiratory problem that will over time get worse and worse and worse. So they're being asked to live with what is a condition that you just can't live with for long. You're over twice as likely to have a mental health problem. And we see, as we've talked about already, huge levels of trauma in this group. You're likely to have more problems with skin infections due to having to take substances in unclean, unsterile environments, using dirty equipment and dirty puddle water sometimes. And we've got two individuals right now who are on end-of-life pathways. They are 39 and 41 years old. So we've got a group of people who are presenting with the illnesses of old age, escaping the traumas of their childhood. And effectively, what that leaves us with is individuals who've got medieval levels of life expectancy. I mean, this is 2021. If this was happening in any other group of people, there'd be a public outcry. But because this is drug users and because of the stigma attached to them, no one gives a shit and nobody gives a fuck. And that is part of the issue that we face. You know, we've talked about stigma, and that is the reality of stigma. It gets you from that point. People die in huge numbers and nobody cares.
Yeah. It became patently obvious to me the last week, the death of that Michael K. Williams, the actor, and it was reported, there was, oh my God, tragedy. And I think New York Post was one of the first to say, overdose from heroin. And then poof, dries up on social media. No one wants to talk about it. Everyone's like, no. We are in this very, very weird world, and it's becoming ever more true to me. I'm aware of my own internalized classism. I've grown up in the Northeast, and I've grown up in sometimes often quite impoverished situations. I've ended up homeless myself, and I've lived on very, very little. And part of that means I've internalized a kind of resentment towards often the powers that be and affluence in general. And for a long time, I thought that was what was guiding me in my opinions of what is going on with this. But actually, it's becoming self-evident that there is a classist overtone to the war on drugs, because there are so-called medical cannabis companies now floating on the London Stock Exchange worth several millions. I think 60 odd million quid has gone through that place on the first year, within the first year of trade this year. Then they're moving to patent psilocybin compounds. They're moving to do research on DMT, LSD, DMT. Dr. Ben Sess is opening a second ketamine infusion clinic for $6,000 a go. Yet look at the way they treat the two deaths at Boomtown those 2 years for ketamine. The second year that they brought in the extra security after that first ketamine death, I think it was 2014, was the most scared I have been at a festival in my life. They brought in a private Portuguese security firm, were one of the teams, and they were robbing people. On the Sunday night, they were going around as gangs, 4 or 5 of them, pushing people aside and just taking all of their drugs. It got vicious. It got scary as a reaction to one tragic death. And I feel for I think it was the young girl was the first one, the first year. I'm not going to try and remember her name, but I do feel for her and her family. I feel for everyone that dies as a result of something that could have been preventable through education, information, and the proliferation of just best practice. If all festival goers, all bar staff, all people that were in public space where people are likely to take drugs were trained in things like how to use naloxone, how to put people in recovery positions, how to actually care for them, to be reminded that they are human.
Absolutely. You know what? We've created an underclass, and if you use drugs, you're part of the underclass. You know, you talk about what happened at that festival, and that is just a complete permission to abuse. Yeah. Because people are using drugs, and it's okay to treat people in that way because they're doing this illegal activity. Do what you want, we don't care. And ultimately they'll say they're doing that to save lives, but it's not about that. It's about power. You know, you want to save lives, then you educate and you reevaluate. You don't rob and abuse. And I think that's, a really good example. I also see a more subtle sort of way that we see stigma. So, looking at things like Facebook, and people can put an image of an individual who's homeless. Can you help this homeless guy? He's got nowhere to live, and he's really struggling with life. And honestly, the comments that you see underneath there are, like, really help this guy. Gosh, we need to do this. He's got. I can't believe that this is happening in today's society. And you think, yeah, God, I feel a bit more heartwarmed. You can put the same picture and say, this guy's got problems with drugs. Can you help him? And it's kill him. It's give him a lethal dose. Send him to prison. You get what you start. He's brought this problem on himself. It's the same guy. It's the same guy. It's the same picture. It's just been posted in a different way. And as soon as you mention that somebody's got difficulties with substances, the attitude towards them changes. They go from being in need, valuable and vulnerable and in need of help to being vilified. And, it just really reinforces that the stigma is there at every single level. And it's just, we're so programmed now that, we're just so programmed that when you see the word drugs or substances or problem, that we shun those individuals. And I see it all the time. I see it with guys who won't go to hospital because they are worried about the care that they'll receive. They just see that I'm a drug user and they don't see anything else. They get discharged quickly. They get put in an area on their own. They feel not listened to. So even in the caring professions, we find a way to leak that stigma out, because we've all been so fed that drugs are bad, and the people who use drugs are bad, and that just keeps going and going and going, and it's perpetuating, and it isn't getting better. If anything, it's getting worse. And the one thing that we try and get across with all of our staff and anybody we have that contact with is that treat people with love. Treat people with love. And, you know, if you do that, then the rest falls into place. Yes, you might have difficult conversations, as we've said earlier. Yes, you might have to say no to some things because, you know, we've got to hold some boundaries around medications or whatever. But you can tolerate to rupture and repair relationships when you treat people with love. What they know about you is that you are doing this from an okay place, not a place of stigmatization. Mm-hmm. That way, you know, I can have the conversation with somebody that's difficult, but they'll come back. They'll see me again. They won't kick off. Or if they do kick off, they'll know that I'll still be there. You know, that if we have to have that difficult conversation, they don't like what the outcome is, I'm still there. I'm never going to walk away from that relationship. And I think that's really important in terms of people being able to get a consistent approach. And I think that, you know, when you look at people with traumatic backgrounds, consistency in approach is really, really important because they have had a very inconsistent approach. They've had situations, things have happened to them in situations that should not have happened. They've met the darker side of humanity. So therefore, we've got to do our very utmost not to get drawn into that place with them. We've absolutely got to meet them with love and respect. Now, it doesn't mean, as I've said, meaning you have to give everything that somebody wants who's got problems with substances, because that sometimes isn't the balance that needs to be struck. But you've absolutely got to meet them with that love. And I've seen the development in relationships and the trust be brought back to people because you meet them from that kind of caring position.
Oh man, you're making my heart swell. Honestly, that's it. That is exactly it. For anyone that obviously knows me, I've been a prolific self-harmer. I've gone through honeymoons with most drugs over my life. I was a very, very destructive teenager and young man into my 20s. So vast, in fact, all predominantly self-destructive. But if I could have had a conversation with somebody in service like you, man, I'd have engaged with service. Because so many times it hit the thing of you could talk for a couple of hours and at the end of it, they'd be like, so you're going to stop the drugs then? So I've just spoke to you for hours about the roots of my trauma, about the therapies that I need, about possible interventions that can help me. And you're going to circle back and go, if I stop the drugs, it's fine. The volume of instances that happened, that is the vast majority of my experience until I got to a point in my later 20s and early 30s of engaging with service to be able to articulate to them that I wasn't wanting anything of them, almost if that I would seek service in a way that meant that they would be honest with me and I would be honest with them. And that has been to my detriment because I'm currently not allowed to access to certain services that I'm trying to get because of my drug use. But that's just something I'm quietly not fighting, but I'm trying to educate them on reasons to why I deserve access. But the existence and the proliferation of organizations like yourself, you are providing a literal rock in an endless ocean where the tide and the wave changes with the socio-political environment. That someone like Ron Hogg steps into the scene and all of a sudden a few places going, yeah, compassion, love, let's do this. And then we see a massive reduction in inquisitive crime and we see social changes really occurring in microcosms and people are trying to really understand this. And then the tide changes again and they're crushed against the rocks. And it's because of people like yourselves, the work of like George Charlton, of people like Fiona at Recovering Justice and other organizations of people that truly give a fuck. That makes you rarer than gold dust in this world. I don't know what's rarer than gold dust, you know what I mean? Whatever a rare element currently is. That's a very old turn of phrase. But I mean it in the sense that doing so is inspirational. And I hope that anyone that's listened to this so far has that respect and that acknowledgement of that you have to take the shit. You have to. I've given hell to healthcare professionals, but the best ones are the ones who can understand it and exactly that, stick with it and see that progress. To understand that the way you are presenting is a symptom and a consequence of your life and various multitude of factors, that it is not a conscious decision for you to go, I'm going to walk in here and be a dickhead. that if you are challenged and triggered and your trauma is brought to the forefront in an often clinical and cold environment, it's hard to feel safe. It's hard to be that vulnerable. You spoke of the man not wanting to go to hospital because of being isolated and having a lower grade of care. I can imagine even just the judgment, the looks of everyone that looks, and the quiet whispers, the corrosive way that'll make you feel. You'd rather risk dying on the street and knowing that no one is looking at you, staring at you, judging you, than being a totem, being put on display.
No, you're absolutely right. And you know, I think when you're not a person who uses substances problematically, then we just don't see the kind of difficulties that people have to go through on a daily basis. And, you know, I'm a fairly well-rounded individual, and I think about times where I can feel anxious about, I don't know, going to the pub, or, you know, we've just come out of lockdown, haven't we? And going back out to meet my mates, and it's like, oh, I feel a bit anxious about this. And, you know, so if you multiply that by 10 and think about, actually, I'm going to have to go somewhere and say to some people, I need your help. And what you get back is quite cold, is lots of questions, actually lots of repeated questions. You know, assessment processes now, we're working hard, and a lot of agencies I know are working hard, that you don't ask the same questions because that is re-traumatizing, you know, and we're not asking what's wrong with somebody, we're thinking what's happened to you. You know, we've got to think in this different way. We've got to find a way that we know that we've got a group of people who for them, having feelings is very, very difficult. And often some of the substances that they choose to use, and I go back to heroin because that is the group I work with the most. What they're doing with heroin, if you think about it, it's a painkiller, but it numbs emotion. You know, the song isn't the comfortably numb, but that's exactly what they're trying to do. You know, we've got this kind of wave of emotional energy. Haven't you had days where, you know, I feel great, and then it's Monday morning, I don't feel so great, but I can manage that. I can kind of manage that kind of wave of my emotion. Some people have got to the point where that is just intolerable, and by using something like heroin, they can flatline that. They can find that consistency. They can find a substance that gives them the consistency that humans didn't. And it comes with all the problems that we know that heroin can come with. But what it does is it numbs that emotion. It allows that feelings roller coaster to be tolerated, so that the anxiety and the fear of people, the fear of being hurt again is lessened. And, you know, that kind of makes sense, doesn't it? If that's, you know, if you've got that level of pain, to find something that numbs that, to find something that helps settle that down, you can see why people, or heroin finds that group of people, and that they find that it's a relationship they keep going back to, really.
Yeah.
So for me, it really is about that, you know, that relationship, that internal relationship we have with our feelings, with our emotions, and how we can learn to sort of tolerate those, so that we're not involved in problematic behavior, really.
Interesting. The way you described that, we could have switched heroin for SSRI, selective serotonin reuptake inhibitors. It's quite interesting. There are millions, tens of millions of people, probably even hundreds at this point, actually, given the state of the world, that rely on these medications every day, yet they are not met with stigma. They are not forced to steal, to beg, to borrow, to sell themselves, to do whatever in order to acquire a minimum enough dose, or even a randomized dose of not knowing what the hell it's going to be, but hoping it'll be enough to pacify and give them that continuity and consistency that we crave. We're creatures of habit. We're creatures of routine. We build ourselves the weirdest little things. We get up in the morning, like I get up every goddamn morning without fail. I make a cup of coffee, roll a joint, take a picture of the joint, or most mornings take a picture of the joint on the coffee, put it up on social media. In isolation, in abstract, that is a very weird mechanism, but it's something that I take comfort from, I take joy from, and it's not causing anyone any harm. And actually, if we then had that regulated supply, if we had those interventions in place, like we do for alcohol currently, that we can all go and buy as much as we want from a supermarket. I often make the the statement that I could be sat here now on a throne of crates and no one would be bothered by it. I could sit here and drink myself to death and everyone would be like, oh, the tragedy of Simpa dying, but not one of us would talk about alcohol regulations or the demons of drinking. It's entirely down to my own individual responsibility. And I think that if we were in that society, and again, idealized utopia, but if we could take small steps towards a vision where substances could be, not necessarily need to be, but could be ubiquitous because the trauma and the need for escapism is reduced. So I think that there needs to be a tandem pairing between everything that you guys are doing with what is occurring with entheogenic research. The MDMA, for example, the majority of time, and the reason I fell in love with MDMA so much was it was like a truth serum, but it gave me confidence and power. So there's going to be people out there, they'll probably be listening to this podcast and they'll discover my work again in the near future, I imagine, that I met and we developed bonds with. And you would share each other's trauma, and you would, talk cod shit, as they say in human trafficking, till the sun comes up in the morning. But in that, you would have a connective, visceral experience where another human being, for at least one evening, understood you, accepted you, welcomed you, and was eager to hear about your opinions and worldviews. That is the thing we crave from the moment we are brought into this nightmarish hellscape of a world that is only in such a way because of the creations of humankind, when actually our natural inclination is to live free, is to be more egalitarian, is to be more loving, more accepting, more, dare I say, socialist, living for each other instead of in spite of each other. And I think that if we can marry these two worlds together, we save thousands of lives and we benefit millions more by them not living in these cycles of trauma, in these microcosms in their own little brain of small worlds that they define for themselves because of incidences that could be dealt with in 20 sessions of an intensive therapy, that could be dealt with a DMT experience or something. That we're really starting to get to the point of understanding that we are the gatekeepers to our own wellness, if that makes sense.
Yeah, it makes real sense. And I think there's real excitement. Sorry, did that blow your head off?
But yeah, my headphones are a bit tuned. Sorry if that came through to you guys at home.
I don't have to turn it off. Sorry, Sim.
That's all right.
You're coming now. Apologies.
That's
yeah, right. I think you're absolutely right. I think we're at a point now, where we're starting to see the potential for these worlds to come together. I think, from my end, looking at heroin-assisted treatment. So bear with me while I try and turn this on.
Thank you. Lovely sound. See, this is a bit of extreme ASMR for all of my listeners out there.
Hopefully that's done it. Hopefully. So yeah, I think we're at that kind of point that you mentioned, really, or certain at the beginning of that. If I think about our heroin-assisted treatment program, that is about allowing people to escape that chaotic lifestyle, that need to rob, that need to do difficult acts to fund ways to manage their distress. And by individuals being able to come in and take dimorphine in supervised conditions, what we've seen is a group of individuals who you would class as the kind of most chaotic, so the most responsible for a significant number of crimes in the local area, most likely to be presenting at A&E with overdoses, most likely to be in crisis with their mental health, most likely to be homeless, just really struggling with every aspect of life. What we've been able to do is to offer this intervention, and that's allowed us, everything's pinging off here.
All right.
To offer that intervention. And it's made a massive difference to people's lives. We've seen people go from that level of chaos to coming in for twice daily doses, engaging in psychosocial interventions and starting to explore some of the stuff that's got them in this difficult place. But we're the only centre in England that yet is providing this. We need to see this rolled out more. We've seen, the community has benefited by just having 10 people on this program. We've seen a 60% reduction in crime in this group of individuals. We know that the people that we looked at to go on the program, we worked out like their kind of how much they cost really. So what do they cost us as a society to keep arresting them, putting them in jail, them failing to benefit with treatment, and then coming back out into the community, and then so on and so forth. We worked out that it was costing nearly £2 million for this small group of people. And that worked out that every taxpayer in Middlesbrough was paying about £5 of their tax towards the policing and prison sentences of this group. So by changing the way that you approach the problem, by addressing the problem in a different way, by meeting the health needs of this group, we've seen that cost completely go, because they've completed their probation orders. They're not going back to prison. They're feeling well. So they all reported that they were basically depressed before they got involved in the program, and they now score higher sort of mental health scores than the general public, or the average in the general public. So we know that if you do things in a different way, then you can have the results that we all want, that individuals want. They want to have a more structured, settled life. The community doesn't want to be impacted by the problems that destructive heroin use can cause. But we're fighting and struggling to widen access to a program like this, and to see it being taken on in other areas. And it comes down to finance, and it comes down to political will. We're in a recovery sort of abstinence-based kind of phase of drug treatment. There's a lot of us out there that are promoting harm reduction, and we're seeing a move back to that. But there still is very much a fixed position of that we need to get people to a point of abstinence, otherwise treatment hasn't succeeded, and that needs to change.
It really, I've never understood the origins of this as a concept, really, of where. I can get that, obviously, if you kind of look at the Judeo-Christian traditions and their prevalence over the past, let's call it 6,000 years, the kind of idea of an access to God has to come through an institution. And a lot of the other cultures that emerged to use at least proto versions of most of the modern compounds that we use as illicit substances today, they use them spiritualistically or religiously, loosely in the terms of the words I'm using there, to access God, to have these spiritual experiences. And I think that as a consequence, that still reigns true at the minute, that we've been robbed of our autonomy, of our right to explore ourselves, whether it be from a position of health into just through curiosity, or it be to explore alternative methods of healing, of helping ourselves. And I think in some way that we live in a weird world where a lot of people are still religious in this country, but nobody really practices it. Come in a push, they'll say the Christian, but I think half of that is Islamophobia. Is almost, I'd rather be this than that, because we live in that much of a binary reality. But I think that priests used to be a confession. They used to be a place to have confidence, to be able to create and fold that culture together. And I think over some point that became the health industry, that became psychotherapy. And rather than it being there to actually help address the things of why the patients were coming in, they were just happy to take in the new patients. And so I think that everything seems to be consequential or after the fact. There's very little being done prophylactically across society to help each other talk. I mean, we get, 84 men a day, a week are killing themselves at the minute in the UK. And with these campaigns of men need to talk. And it's like, men are talking. Very few people are listening. It's the same with the peer-led drug community. We're fucking talking, but we are banned from platforms. We are not given the same opportunities to speak alongside prohibitionists or the campaigns that are now advocating, as you say, for basically drug-free worlds again. This idea of that we can just defeat this scourge. Drugs will always exist. That will never, even if you win the war, as it were, the drugs will always still be here in nature. The idea is to defeat the need for people to destroy themselves with a substance to escape the pain of their reality. And that comes from asking some seriously difficult questions. And I think
it's sorry, Sam.
Yeah, and I think part of that comes from, like I said, services like yourselves creating that safe space. So I imagine the way those 10 individuals engage with you and your peers when they come in. I don't want to use the term shooting up because it's got such horrible connotations. When they come to consume their substance, they don't have to hide it. They can look at you and be proud, and almost they're not facing that same mire, that same crap that they get from everybody else.
No, absolutely. And one of the big things that we've had fed back is that, the experience. So people were worried that when they first came in that, is a clinical environment, it looks very clinical, and we are taking what, a substance that people may use socially and kind of doing it in a very sort of clinical way. And some of the sort of patients were worried about, using the medicine in view of other people, in view of staff. But it didn't take us more than 1 or 2 days of individuals coming in and realizing that we are okay and they are okay, and we're not sitting in judgment, and it's just not an issue that anybody considers who's been on the program for a period of time. The relationships that we've been able to build, spending 2 parts of your day every single day, 7 days a week, allows you an amazing privileged opportunity as a mental health nurse. I've really been able to spend a good amount of quality time with the people that are using our program, really get to know them. Guys that could not turn up for an appointment, they'd be the guys that would ring on Monday and say, I'm on my way, and I'd see them at 6 o'clock on Friday if I was lucky, because life just didn't allow them to get where they needed to be. Whereas now they've got a level of structure whereby that they can come in, pre 9 o'clock, and you'd never imagine that as a group of people they'd be able to do that. They can come in, have the dose regular as clockwork. We can spend that time. We can do some therapeutic stuff. But I think for me, the biggest therapeutic intervention is that we are there for them and they're there for us. And as humans, this is a period of time for this group of people that have not been able to have that kind of experience before. And that for me is one of the biggest sort of privileges of being part of a scheme like this.
Mm. So, yeah, I can imagine, because it's something that I kind of discovered through doing activism, and the thing that made me feel most alive and made me feel most human was actually doing something for somebody, was that being in service of somebody else and watching in some small way my efforts or my actions translate into growth or evolution in their life or in their business or in their positions in the world, their ideas and concepts, you know what I mean?
Yeah.
And so I definitely resonate with that. Something I did want to ask you is, do you, because there is this kind of argument that is emerging, and it's almost like you guys or foundations and that you're part of like that. Let's call it the first wave of let's call it first wave of the new century of drug activists. So it was like Danny Kushlik and Transform and those kind of programs. Quite a lot of you kind of came on the scene at the same sort of time, quite radical, quite well involved, really well informed, and pushed the narrative forward quite a lot. As you said, there was this switch at some point between an acceptance and a harm reduction of these people are going to use these substances, let's reduce the harm, to then almost, I guess, a debate arose to what's the end game here? Are we just going to give them drugs forever? And that conversation has never really been settled as far as I can see within reform. It's just, and I understand why, because people like yourselves, as I was saying before, are literally just applying plasters. You're doing field triage in a war zone. So you can't begin to think what peacetime looks like if the war is still going on. But the oppressors sure as shit can. The guy sat there with their, 12 subsidized bars in Westminster, getting pissed every lunchtime, making the rules for this. Is there a conversation, a dialogue that you have seen within the community, within sort of drug reform, towards settling this debate? Are they going to try to move towards this drug-free world and we'll eradicate heroin and we'll eradicate crack? Or are we actually moving towards this acceptance that, same as we are with cannabis, I guess, you have to kind of learn to live with it?
No, I don't think we're moving towards that world at the moment. I think the approach in the UK is twofold, really. One is an enforcement approach, so to reduce the supply.
That's going well.
Absolutely. And the second is to improve the treatment offer. So you've got a reduction in the supply of substances is the theory, so that less people are harmed by the evils of drugs, and that for those that are harmed by the evils of drugs, that they can access the treatment they need to get to a point of abstinence. And I think that's very much the position that we're in. Within that space, you have harm reductionists, you have people who kind of talk about the need for things to be different, and you've talked about that many times, so I don't need to go into that any further, really. But no, I think to answer your question, we're not in that position at a government level. There are changes. I mean, we have all-party working groups for the change in prohibition. We have the same for the Tories and for the Labour Party. So we know that there are groups of MPs who you need to have on board for anything significant to change, who are thinking differently, who do want to see change, but they are still in a minority.
Yeah.
But we are at the edges of that. I think, we've all got to believe, and I believe that if we keep having the conversations, if we keep working in an evidence-based way, the evidence will win, because the evidence is clear, and you can't go beyond. A moralistic argument can only last for so long. Yeah, it's lasting a long time. But the evidence is very, very clear. If we do something different, we will get a different result. We will get the result we want. And I think, like you've said with the psychedelics and that kind of shift, yes, that's got a journey to go with, and how people might capitalize on that is a concern. But we are starting to enter into that space where we see substances in a different way, although it's very early days. And I do hope that, podcasts like yours, the work that we're doing, the work that lots of other people out there are trying to progress, not just in our country, but around the world, that we can see the evidence come to fruition.
I sincerely share that hope and that vision. And I do see small cracks in the monolith, as it were, and progress being made. What worries me is what we kind of touched on earlier with the classism argument, that Glasgow can remain in the position it's in, that Middlesbrough can remain in the position that it's in. In fact, basically take any one of the deindustrialized cities in the UK and look at their consequential drug problems that have arisen because of poverty, because of socio-economic policies. And what worries me is then these clinics popping up in Bristol and in London offering ketamine infusion therapies at $6,000 a pop. The problems the people have who can afford $6,000 a pop in private healthcare are vastly different to that of those that we're probably not going to see $6,000 over a decade. Do you know what I mean? We're not going to come even close to this. And I think that there is the risk that an entire population group are going to be left behind, not because of the moralizing of drugs anymore, but simply because of the class that they have been positioned into as a consequence of their drug consumption.
Yeah, I think that's a really valid point. And, I go back to what we said. We can, we've talked already on here about the problems we see in a town like Middlesbrough, and you raised Glasgow. Glasgow's got very similar problems extrapolated, on the edge of a HIV crisis in the injecting drug using population, that we just don't need to, people shouldn't have to go through these kind of problems anymore. There are different ways. But it is perpetuating. We know Glasgow is ready. It's ready to open a drug consumption room that should make a difference. But the forces that be in Westminster have prevented that intervention from going ahead. So, your political point is a really valid one. The point around class is a really valid one. I don't know how we get beyond it right now, but I think that's one of the biggest problems that we face as a society, really, in lots of echelons, not just the world of substance use. what I do know is that if we keep working to support people with compassion and love, then we can make a difference. It might not be the biggest difference that we want to make, but it makes a difference to that individual.
Yeah, I echo that. I'm quite aware of time as well, so we'll move to round this up. And yeah, I would just say to our listeners, to anyone with any doubt that who thinks that someone like yourself or the work that you guys do isn't really affecting the larger picture, but even if what you said there, you've taken 10 individuals and you've given them an opportunity at life again. You're giving them a chance to have an adulthood that allows them to deal with the trauma of youth, to give them that old life, to give them the opportunity to reintegrate, to re-enfranchise, to exist, to be accepted, to be seen. And that is powerful. That is truly powerful. I often take a lot of flack on this, and have done for years, about my stance against all drugs. I am anti-prohibitionist through and through. I do not believe you can prohibit a behavior and criminalize the consequence of someone's trauma. If a government is worth anything, if an authoritative institution and the idea of us being ruled is to continue, then it has to serve the people. And I think the projects like yourself are doing amazing work to show the tangibility, the feasibility, and break down the data sets that could actually show that this not only works to better their lives and better the wider society, it saves money and it proliferates love into the world, which is going to sound so hippie-ish to some of my listeners, but fuck, we need some of that shit right now. If we could intravenously all be injecting love, I'm sure we fucking would. So brother, honestly, thank you so much for being on. Guys, you will find the links below in bio. You can keep up with Danny on his Twitter if you don't mind me sharing that. You do have some quite interesting tweets. We'll also share the foundation's website. And for anybody that really enjoyed this, you want to continue the conversation in the comments below, more than happy to debate anybody that wants to kind of have a conversation about just stick to cannabis, because ultimately the win for heroin is the win for cannabis, is the win for LSD, is the win for drug consumers, human rights, the right to be weird and wonderful, and for you to dress up as a furry and go to a festival and get fucked off your face. So we're going to keep fighting this. Check us out on Patreon, where you can, for less than a cup of coffee a week, you can keep us going with this little project. We're on all social media platforms at TheSimpa Life. I've been Simpa. This wonderful gentleman has been Danny, and we will see you later. Peace and love.